Thank you very much for this opportunity to come and meet with you all for some training. Today we're going to focus on upper extremity. But first, before I get started, I want to give you a brief history on Medi. We have been specializing compression for over 60 years. We are specialized in both ready-to-wear and custom compression garments for the treatment of lymphedema and wound care. And we specialize in circle knit and flat knit garments, and as well as Velcro and elastic garments. Today we'll talk a little bit about our ready-to-wear circle knit and flat knit garments, as well as for upper extremity, and then our Velcro and elastic custom garments for upper extremity. Many times the referrals that you're going to get at most of the government installations are probably going to be ready-to-wear. You've got family doctors, you've got lymphedema therapists, you've got vascular, as well as cancer centers prescribing garments for both palliative care, mild swelling, as well as treatments for post-breast cancer surgery, post-mastectomy. They're going to need arm sleeves and gloves to manage any type of swelling. Also, minor injuries or post-burns or burn garments. Our garments work well for that as well. So there's a variety of reasons why compression garments are going to be prescribed, but the main reason is going to be just either for mild swelling and edema, as well as other more serious indications of lymphedema or wound care. And we'll get into that later as we go on about the garments. We'll focus on upper extremity today, and then on the next training we'll go over lower extremity. So for one of the main reasons that you're going to get your patients and our active duty coming in for compression garments is lymphedema. In the brochure I have here, this is going to talk about I hand this out to a lot of therapists as well as physicians throughout who need to go over the different stages of lymphedema with their patients. There are 3 different stages of lymphedema. And it's important for you to know because the prescriptions are often going to come through with this on there, or when talking to the patients who come in, you need to ask them a little bit about their stage if you're going to get a little more history from them that they're getting from their clinician. So stage 0 in the first image is the lymphatic vessels are already damaged, but there is not yet any visible swelling. This is often referred to as subclinical lymphedema. So this might be patients who are getting ready to have a surgery. Maybe they're having some increased pain in their arm or heaviness. They've had surgery or lymph nodes removed, and they're starting to feel some different sensations in their arm, heavy arm, starting to feel a little bit of changes, or they're getting ready to have a procedure. So this is that stage 0. Or they've had surgery in the past, lymph nodes removed, post-mastectomy, and they are at risk for developing lymphedema. Stage 1 is swelling. It is only seen in the evening and disappears when the arm or leg is elevated. So their lymph nodes or the pathways have been damaged in some way, and they're starting to see some swelling and edema. So this is stage 1. They're going to be diagnosed when they're either by a clinician or their doctor, oncologist, or family medicine doctor, or a lymphedema therapist. Many centers are now incorporating visits with the lymphedema therapist part of their treatment from a prophylactic standpoint. They're going to automatically have a few visits with the lymphedema therapist because they're already at risk for lymphedema. And the image that you see in the picture here is highlighting that the therapist will, or the doctors can push on the limb on the arm and have the pitting edema. So it takes a while for the skin to retract back. You can see a change. We can all do that in our legs and our arms. Many of us have that just from daily, we have swelling in the legs from standing all day or walking. So that pitting edema, it takes a while for it to come back, for the leg to go back to its, or arm after pushed in. Stage 2, the edema can start hardening and no longer recedes with rest or elevation. Initial skin changes can take place, including hardening, where indentations no longer happen when pressed. So hard skin, the skin starts changing feel. It gets either softer, it can get a little scaly. Many times it'll, in some instances, an orange peel-like effect on the skin. When a person has stage 2 lymphedema, it's filling up in a limb, so they're getting substantial swelling, whether it's in the arm or the leg. It might build up in a certain area at our joints, at our wrist or at our elbow or at our knee or at our ankle. There might not be swelling there, but they're swelling outside of it. So they can have a buildup in the upper arm or a buildup in the lower arm where the lymph nodes are blocked. It's not being able to get through the passage of our axilla. We've got lymph nodes throughout our whole body. The main ones, big clusters, are at our neck, at our arm, underneath our arms, at our hip, and then behind our knee. So those are some of our big clusters of lymph nodes. Many times with your breast cancer patients, they are having lymph node dissections or lymph nodes tested in the axilla, which then they're going to have some backup they may have some backup in the arm, and that's where they start seeing the initial results, and you're going to have prescription for compression garments, both ready to wear and custom. Stage 3 is swelling reaches extreme proportions, the limb is misshapen, the skin has hardened, and lymphatic fluid can leak from wart-like growths, small blisters, or fistulas if they develop. Risk for skin infections and deep, poorly healing wounds increases. This is oftentimes, when you get to stage 3, this does not happen overnight. This does not happen within 3 to 6 months. This is something that has taken years to develop. Many times it's been misdiagnosed. Oftentimes we see that there are other indications going on, obesity, lifestyle. So it has gone misdiagnosed for years. It can happen quickly over a course of a year, and that's oftentimes they're embarrassed or afraid to get it checked out because of what's associated. You've got somebody who's gained quite a bit of weight, and then they've developed lymphedema because there's been a breakdown in the system. The body is working hard to manage the weight, but then also the lymphatic system can break down. So you're probably, I've noticed, Lauren, correct me, I don't think we see too many of the stage 3 come through, but you may see, because active duty dependents and military have different issues. Weight, when you start, maybe there's an injury of some kind due from their service, and they become a little more sedentary. They've developed lymphedema of the lower extremity of the arm, and they're not moving around as much. That can all contribute to their symptoms getting worse. There are 2 kinds of lymphedema. You can either be born with it, and that's called primary lymphedema, or secondary lymphedema, which can happen from a trauma of some kind or blockage of the lymphatic system. So 2 kinds, primary and secondary lymphedema. The majority of the people that you're going to see are going to be secondary lymphedema. Already in my time working with you all, we have had some primary, some children, very rare, but mostly you're going to have secondary. It's going to be from treatment of some kind. Any questions? So this brochure is a good indication just to review, to familiarize yourself with the different stages. You're not diagnosing any patients or giving them any advice on their treatment, but to be aware of when you can ask these questions or ask the clinician if you need further information about the prescription that you're getting. So to move on, we're going to talk about first our ready-to-wear upper extremity. We have 2 different options for arm sleeves and gloves. First, I want to talk about the difference between circle knit and flat knit. When we talk about circle knit garments, circle knit are going to be the majority of the compression stockings that you have on the wall. They are manufactured in bulk. They are made on machines that have over 150 different needles. They're manufactured in a tube. They spit out and they make it through the processing line. So that's circle knit, something that's going to be round and elastic with greater strength, or excuse me, over 100% stretch in the garment. So for your compression stockings ready to wear, and both for our arm sleeves. So when we say circle knit, think circle, tube. Medi, we manufacture all of our ready-to-wear products, both compression stockings and arm sleeves and gloves here in the United States. They're made in Whitsett, North Carolina. They are all manufactured by machine and finished by hand. So everything has touched human hands and are finished, whether it's our top seams or the finishings on the end. The same for our stockings, all finished by hand. They come out of the machines white and are all dyed the color that they are. So for our colors from beige, navy, black, everything is dyed the color. So sometimes you may see some variations in colors because they are dyed in batches. On some rare occasions, people who need it for both arms have been, there's been a notice, but that's on a very rare occasion. But I do like to let it know that they are dyed in batches and not all, it may not be exactly the same in the moment. On all of our products, it's hard to see, but the item number and batch number are sewn into the product. That's more from a manufacturer standpoint if we need to review the product for any defect of some kind. Medi has a 30-day wear and comfort guarantee for all of our products, 30 days from when the customer purchases it from you, not 30 days from when it's purchased from Medi, 30 days from when they purchase. In some instances, we'll ask for a receipt of purchase, but most of the time we don't. But 30-day wear and comfort, and that's going to cover any sizing issues, any quality issues. It's important when you either reach out to me or reach out to customer service for any type of adjustments in product. Be sure to say, just to help you out a little bit, say that it's a sizing issue, we need to try a different size. If there's a quality issue, we're going to want to see it back to then evaluate it. So just to save y'all time, it's better to say that it's more of a size, which is going to be the majority. It's a little too tight, or maybe the top band doesn't feel right. We want to try with or without a top band. So 30-day wearing comfort. Now, whatever your policy is on returns for compression, we stand by that. We want you to know that this is for you, for the account. We honor what your request is or your return policy is. Every place is different. Some don't have, there's no returns on any compression. So just know 30-day wear and comfort. If the customer says, within those 30 days they don't want it, just know that we will credit you for the product, and it would be up to you whether or not you're going to issue any credit for the customer on that. So 30-day wear and comfort, 6 months compression guarantee, just that our compression will last. Our 30-day wear and comfort does not cover any snags or tears for garments and stuff. However, you reach out to us. We've got some situations that are one-off. We want to do what's right for you and for your patients, but it's important for you to encourage the patients to buy gloves and go over the safety on how to don and doff the compression garments, because they can snag and tear for both the arm sleeves and the gloves. But 30-day for wearing comfort, that they've got the right size, fit, so on and so forth. So when we talk about circle knit is made on machine in a circle. There are no seams. On the piece of paper that I have here, we've got a harmony. We'll talk about the harmony first. This handout's going to review both features and benefits, as well as indications. So on a circle knit harmony arm sleeve, you've got a very, this we say is a combination of soft and strong. It's made in a circle. It comes in 8 different sizes. And that's one thing that makes Medi unique, is our sizing options. We differentiate our product in numbered sizes versus small, medium, and large. So for harmony, we have 8 different sizes. We have also extra wide options for the arm. We have options for with a silicone top man and without. And you can also get an arm sleeve with a gauntlet attached and a separate glove. What makes the Harmony unique is the shape. It comes in one length. It has a good vertical stretch to fit over most arms. People with abnormally long, I don't want to say abnormally long arms, but very long limbs may have to go into a custom. But our Harmony ready to wear fits the majority of our options. This is indicated for patients with primary or secondary lymphedema and 0 to stage 1. So 0 to stage 1. So it's important to know that when you've got somebody stage 2 or higher, or maybe a larger limb, we may need to go to a custom option because it might not be containing enough for the level of compression that they need. There are 2 different levels of compression. Compression 20 to 30 and 30 to 40 that the Harmony is available in. Harmony has at the end of each of the arm sleeve, we call this a porous row. Porous row means there's less compression at the ends or the distal or proximal ends of the garment, so there doesn't create a tourniquet at the joints. We do a porous row, then the compression starts in a gradient form, so it's tightest at the wrist and gets less as it moves up the arm. There is what we call an ellipse that you can see on the crease of the elbow as well as at the back of the elbow joint. This is a break in the compression to help facilitate lymph flow as well as make sure there isn't a tourniquet there at the joint, where many times you're going to see patients with a big, either they've got a fuller upper arm from just adipose tissue and skin stretching over time, or fullness in the upper arm and then the forearm is unaffected. So you'll see that a lot, an unaffected forearm but a fuller, softer, heavier upper arm, or vice versa. So many times the joints or where it ends, how it flows is a little bit different. So that ellipse adds comfort and a little bit of break, so we've got good lymph flow and no pinching at the elbow, but facilitating lymph flow on that. If you turn it inside out, our Harmony has little nubs throughout the material. That's providing a micro massage to the skin. Helps massaging, and lymphedema patients, when they're getting treatment, do what's called, their therapists teach them how to do MLD, manual lymph drainage, which is a massage-like technique on the arm that helps move lymphatic flow to then drain through the body. This provides a micro massage to the skin with those little nubs, while also, if you look at the weave, when I pass around, you look at the weave, you'll see that you can see through it, and that's important because it's also providing breathability. So in this garment, you've got moisture wicking properties, you've got micro massage properties. This is also, you'll notice the softness in it. We make this with lanolin, so it's moisture wicking, but keeping the skin from drying out. It's a very unique option, or it's not an option, it's very unique in Medi that we have products with lanolin, and our upper extremity on our arm is one for the Harmony that we highlight that on. No other manufacturer has that lanolin in there. It's important. Skin integrity is so important when treating patients with lymphedema. We want to keep the skin soft. We want to keep it from drying out. They need to use their lotions, they're checking their skin always to make sure there's no breakage. They're encouraged to wear their arm sleeves and gloves for travel, airplane travel, working in the yard, exercising, because in the summertime or those activities can trigger flare-ups or can trigger the onset of lymphedema. So flying, changes in elevation. Many patients who don't have any symptoms will get gloves from a prophylactic standpoint to help keep the compression on for when they fly or exercise heavily in the summer. So I'll pass it around so you can feel the material. It's very important to feel and touch it to be able to understand. So the Harmony, I have 2 of those. Harmony comes in, we've got 3 colors: sand, caramel, and black. You can get the arm sleeve with a silicone top band that you see there, and that's our dotted silicone top band. The dotted silicone top band is good for most patients. It has a good grip. Flat, it's small, so it doesn't impede. If they've got any sensitivity from radiation in the axilla, it's a little bit softer under the arm. You can get it without the silicone top band. It also comes with a gauntlet attached, so you can get arm, sleeve, and gauntlet, so one piece. And that is good for when your patients have fullness throughout the hand and wrist area, and they want one smooth garment, so no break in the compression. You'll notice on the glove, the porous row, you can see it in the weave. That porous row is designed so it can overlap the arm sleeve, and feel free to try it on if you'd like. Overlaps the arm sleeve so to not create a tourniquet. On the seams of the glove, we've got a nice Y, and on the gauntlet, it'll stretch. It'll fit you that size. It'll stretch for sure. That flat off-center seams, so it doesn't create any break or discomfort between the joints of the digits. So soft, flat, off-center seams. You'll notice a difference when you compare side by side between our finishes and our seams. Very smooth, flat, little to no pilling or open ends of the stitching. We really take great caution in making sure we have a nice, flat, smooth seam on all of our garments, especially in the gloves and hands. I get the most scripts and compliments on our product from our therapists for those very reasons. Very durable for daily use. Being that it's circle knit, 6 months, you want to encourage your patients to come back and get another pair. It's something that they're going to need to either get multiple pairs depending on what they're doing, their lifestyle. The gloves especially take a beating with everyday use, so sometimes they'll want something, they'll want a backup that's going to be their working glove or a darker color for when they're, because the lighter colors can show the dirt, and then a nice one that they're going to wear for nicer occasions that doesn't get beat up as much. So that can happen. They're not indestructible. They can pill. They can catch to Velcro and materials like that. But so it's important to encourage, I know a lot of this is driven based on their insurance and what that provides, but strongly encourage them not only to help the upsale for the store, but to encourage them for therapeutic reasons. You wear it, you have multiple pairs, it'll stay nicely, and your condition will be well managed.
Okay, does that come with, I've seen some with shorter fingers?
Yes, we call that a gauntlet, or actually, well, shorter fingers individual, or just an open?
Shorter fingers individual.
We can do that on a custom option, on a custom glove, and we'll talk about that next for the flat knit material. We can do that on a custom. The Harmony comes with a gauntlet glove, so that would be where it's completely open and it slides over the top, and there's no individual individual finger holders. So that gauntlet is, again, compressing the top of the hand and the arm and the wrist. And many times somebody might use the glove for daily use, but if they've got to do a lot of typing but they still have swelling, they'll go into a gauntlet. If they've got to do something individual with their hands, you might encourage a gauntlet that's still going to provide some compression over the dorsum or the top of the hand where there can be some puffiness. But if they want to make any changes to the length, we would have to do custom options on that.
So the Harmony is off the shelf.
Off the shelf, ready to wear, made in large batches and different sizes. So we've got 8 different sizes and extra wide sizes for the arm sleeves, and the gloves come in 8 different sizes as well. In your Medivin Circade Lymphedema Guide on page 10 and 11 is the sizing charts that indicates the different size options. You'll notice that we have options for extra wide E and extra wide G, and we'll go over the different landing marks. You can't, it's either, if you need an extra wide, it's either an extra wide option all the way across or a standard option. Does that make sense? So you can't have, when you're looking at the sizing chart and you're making your way up, you can't jump in between well, this fits extra wide, or mid elbow, but standard upper arm. So you've got to, we'll take that into consideration. When you're measuring for Harmony, you're going to take your tape measure, and there are 5 different marking points that you will need to take measurements from. I'll use you as an arm. Use my arm. You want to fold up your arm?
Sure.
Is it okay if I get up? The A measurement is at the, or excuse me, you'll take the palm if you're measuring for the glove. You take the arm, you take the tape measure. Ask for them to spread their hands wide. That's just so we take the widest measurement, so it's not at the tightest. I recommend measuring over the knuckles and the bones. So spread your hands wide. Actually, for that A, you're going to do the palm, but you still spread your hands to make it wide. With no tension, because this is an area, it's a joint, so it's a smaller area, we don't need tension. You take that measurement, and we've got about 24 centimeters at the palm. Then you take the smallest part of the wrist. I do like to include the bone on this. Take the smallest part of the wrist. Again, no tension. We've got 19. Then the next measurement is C1. And when you see C, that means circumference. That measurement is where the arm starts changing shape. So a lot of times it's either oftentimes on average about 5 to 6 centimeters, or you can take by just noticing with like sliding up the arm to see where it changes shape. On him, I'm going to take C1 here. This measurement is not as important, so it's optional. If this measurement's a little off, this one isn't as important, but it will determine if they've got a fuller forearm or not. You may have to. So if their forearm is involved a lot more and bigger, that can be more important. But if they've got a normal shaped limb and it's a little off, you don't need to worry too much. You can take a little bit of tension on here. Take that measurement. Then the next measurement is circumference E. This is taken right after the elbow. So bend your arm. So we've got his elbow here. It's taken right above that. You don't want to take it at the smallest part. We're taking it slightly above the elbow, the bend of the elbow. Take that, no tension because this is at a joint. Take that measurement. Then G, circumference G, is at the top of the axilla or at the fullest part of the arm. You take that circumference. You don't need to take a length measurement because there's no length included. It's only one length in this garment. However, if after you put it on and they've got extremely long arms to it, you might need to consider a custom garment if it is too short on them. So that does happen in some cases. But those are your simple measurements that you take for the Harmony ready to wear. You want to stay within, we account for about 1, maybe 2 centimeters in size, centimeters differentiate. Anything outside of 2 centimeters that it doesn't fall within that size range, you either want to consider a custom garment. Things to keep in mind or to take into consideration: is the patient maintaining where they're at, or are they trying to reduce? So if they're just about like almost 2 centimeters too small, but they're going down in size and reduction is the goal, you might be able to go with that smaller size. If they're maintaining and we need to jump to the next size, you might need to go to the larger size. But anything outside of that 2 centimeters off, we want to consider a different size or going into a custom garment. It's very important to, one thing I like to strongly emphasize, that this is a medical device. It is prescribed. It's not, everything that you're selling here are devices that are prescribed and important for their care. Most are going to be covered for insurance reasons so that you don't have to worry too much about your patients having difficulty with price, but it's very important to encourage them to have the right size, the right fit, talk about the level of compression that has been prescribed and the importance of that. Many times they'll get it and they say, well, this is so tight or it's uncomfortable. That's something that they will need to discuss with their therapist, but this is what is prescribed for the indications and their condition, and that it's needed to help treat their condition. I know you go over this with all of them, but compression is and compliance is one of the biggest issues that is faced in our industry. And we just want to strongly encourage all of our customers that they need, yes, it might be tighter. It takes practice and getting used to something that they're not used to wearing, and it's tighter, but it is helping their condition. We don't want to go to a lighter compression if they were prescribed a 30 to 40, just so they wear something. It's very important to just strongly encourage, this is what's needed, this is what you're prescribed, and then, talk it over with their clinician for other issues. Obviously, we're not diagnosing anything, we're not doing anything on that nature, but we want to make sure that you're sending them home with a product that's been prescribed for them, and not something that they've talked you into going lighter because it's easier to get on. Because then it may not be helping or containing. Lymphedema is very strong. Lymphedema will build up in your arm or your leg and push through light compression, and then symptoms can get worse, and then there can have skin changes and hardness. When the skin gets hard, that's called fibrotic, and when it gets fibrotic, that's the change in their condition, and it's getting worse. Things can get softer, and you can get back with the therapy and with other treatments, but we still want to use those garments to contain at the appropriate level that they have been prescribed. So the Harmony is indicated for stage 0 and stage 1 lymphedema. It is a ready-to-wear option manufactured here in North Carolina. They are made in batches. They are dyed to their color. 30-day wear and comfort guarantee on all of our products, both ready to wear and custom. Any questions? Do you want to practice how to measure on the ready to wear?
I did have a question.
Yeah, please.
Just if you could go over again
Yes.
the 2 centimeter protocol.
Yes.
So 2 centimeters off. How were you deciding again?
It's
go
more.
down or up?
So let's look at page 11, and let's look at we'll look at size 4. So page 11 of the Harmony sizing chart. So if we let's look at size 3. It doesn't matter. C is the circumference of the wrist, and that's 15. And we do almost everything in centimeters for Medi. It just helps to stay consistent. You can do in inches, but then you're going to have to convert it, so just stick to centimeters. Size 3 for the wrist is 15.5 to 18 centimeters. the C1 is 17.5 to 20. E is 25.5 to 29, so on and so forth. So these different sizes. Where I'm talking about the 2 centimeters, maybe the G, so maybe they fall into the range for the C, the C1, the E, and the G is 34 centimeters. This would be where you'd look to see, well, how are they? Do they anticipate losing some weight up in the arm because it's a little bit fuller and they're going through treatment and it'll get a little bit less? Same for, and it's on the G sometimes, that's harder to really, I don't want to say fudge or get a little bit of leeway because it's tighter. So if they're a little bit heavier naturally, they've got a little bit of extra skin up there naturally, got to take into consideration, even if the edema in the arm goes down, will they still really lose any girth or circumference in that? Patients who are older and have really soft, fleshy skin that sags naturally, that's where you'll take a little bit of extra tension to kind of lift that up. We don't want to just take it where it's really low. We want to lift that up to where the skin stops sagging a little bit, because they'll might need to tuck that in a little bit, because that's full just in general from age and soft adipose tissue. Real quick, so at E, if you've gone to that 30, so let's say for the size 3, they go into that 32 centimeters. You're out of that size, that middle size. It might be too tight there. We then want to look at size 4. Do we fit within there? Or if they're going to go down a little bit. If not, if they're off, we accommodate a little bit, 1 to 2 centimeters. But if they're outside of that too much in that area, we want to consider a custom option possibly, because they just don't fit into that ready to wear. It might be uncomfortable and cause problems. I'm sorry.
The compression is measured in millimeters
Mercury.
of mercury. Okay, now let's say you got a size that's smaller, that would change your compression. So the more pressure the more pressure, the more edema they have. So it causes the garment to get tighter. So will that make that much of a drastic change where they would have to?
It should not, but that might be something after they wear it a little bit. There's a pressure point to take into consideration. We don't want to put them in something that's all over too small. That's why we have the 8 different sizes. We've got the most custom-like size options and small incremental changes to get a custom-like feel. So if there's one measurement that's 1 to 2 centimeters off on the arm, sleeve, and glove, that's okay, and that's not changing the overall gradient compression, because you've got 100% of the compression is here at the wrist, and then that pressure gets less as it goes up the arm. So the millimeters of mercury are greatest here at the wrist for the arm sleeve, and then it's less as it goes towards the axilla. And you can notice that on the feel when you put your hand inside the sleeve. It's tightest there, and then it gets less. Elastic in its nature wants to get to its smallest form. So like rubber bands that want to continuously get smallest, that is something to consider. And as a person's lymphedema changes, if there's somebody who's stage 1 going into stage 2, they're going to start swelling, and that's not going to be containing enough for them. So that might cause some additional, it's not going to cause additional swelling, but they'll notice additional swelling, they'll notice continued pain, because the garment itself, even the level of compression 20 to 30 or 30 to 40 is not the same as the amount of pressure that a flat knit garment can do. flat knit, when we get into talk about that, is more of like a short stretch bandage. It it does not stretch over 100%. It's a little firmer in nature to provide a stronger force against the wall of the skin. So I hope that answered the question a little bit on that. But that's a good question to ask. You've got your grading compression, 20 to 30, 30 to 40. We don't want to sleep in these garments. They want to wear it during the day. And the reason why they don't want to sleep in it is a lot to do with the fact that the elastic wants to get to its smallest form, and it can cause some discomfort because it's getting smaller and applying pressure to the skin when the body is at rest, when they're recumbent, and the pressure is not the same on the body as if you're standing and walking around and gravity is impacting it. You're at rest, the pressure all throughout the body, same for the legs, is less. So you don't need the pressure to support the vessel walls like you do when you're standing and walking and gravity is taking effect.
How many hours of the day should it be worn?
That depends on what their therapist wants. There's no specific hour time. You know, I know plenty of patients who do wear these all day and sleep in them because it feels good for them. And if that is what works and that manages and their therapists know about that, that's fine too. I know plenty who sleep with their gloves at night because of other discomfort and pain when they're not wearing it because of the filling up of the fluid at night. So that really, most of the ready to wear is, again, just somebody who's got some mild swelling and edema and is able to be managed with circle knit garment. Questions?
I have a question.
Yes.
I don't have lymphedema or anything like that, but I do have nerve damage and carpal tunnel in my wrist and hands. Could I wear something
Yes.
like that?
Many times these type of gloves are prescribed for that very reason. Sensitivities, swelling, nerve pain. You may be familiar in the past with like isotoner gloves and things of that. These have mild compression. The fingers on the gloves have 50% compression, so less compression in the fingers than at the wrist. Many times, that support is a good indication for needing the glove. On our indication, shoulder and arm vein thrombosis, post-operative and post-traumatic edema. So a surgery on the hand, they might not have lymphedema at all, but a surgery and some swelling and some scar tissue, a glove is appropriate for that. Primary and secondary stage 1 lymphedema of the arm, hand pieces, prevention of accumulation of fluid in the hand area while wearing an arm sleeve. So yes, so support and pressure, compression can help all of that.
So then, in the same kind of vein of questioning there.
Yeah.
Same thing like diabetics and things like that. It's appropriate.
For the hand.
Yeah, if you're diabetic, if you have nerve issues or anything.
Possibly.
Like that,
Yep. And most of the time that might be on the lower compression, like the 20 to 30.
Okay.
But when diabetes is involved, because many times they're controlling the blood flow a little bit more towards the heart, you want to make sure that's talked over with your clinician, especially when we're talking about the lower extremity for the feet, because they're monitoring cuts, wounds, and things like that a little bit better on that. And if they have neuropathy and they can't feel it, that's often something to be more aware of. But yes, diabetics can wear our garments. Okay, cool. Thanks. Then the other ready to wear, and so ready to wear is most important today. We got all the time in the world for all my other videos. I'm going to be a rock star because I'm going to put these on YouTube. The next one is our Mondi. So if you go to page, I think page 12. So we have a ready-to-wear flat knit. Page 12 and page 13 are the sizing charts for the Medivin Mondi Esprit upper extremity. So the Mondi Esprit is a flat knit. So like our circle knit is made in a circle on machines, This is made in flat, laid out, stitched, and then sewn together with the seam. So that makes it a more stout material, less stretch, more of a solid wall on the against the skin to prevent the skin from swelling or changes in the limb. The flat knit on here is a more robust material that's providing a massage to the skin to help break up any fibrotic or hard tissue. This is indicated for stage moderate lymphedema and moderate lipedema. So you'll see patients with lipedema, and that is the buildup of fatty tissues in the arm, and they've got a lot of sometimes you'll see it looks like a lot of cellulite either on the arms or on the legs, but it is a condition where there's a buildup, and they've got oftentimes indicated with fibromyalgia and pain. So a flat knit can help contain and lift and compress the skin better than a circle knit to provide good compression and relief of some of those symptoms. So we're one of the only manufacturers that offer a flat knit in a ready-to-wear. This comes in 2 different lengths, a standard and a long. Forget about the standard. Always order long. The standard is like this long. It's so short. And so this is the long. It has built-in a knitting mark, and a knitting mark gives that shape like the arm, a bend in the elbow. That is a customized option on a custom option. You can make that bigger. It's more material. Let's show the one that doesn't have my scars. Scars all over. So that creates flexibility in the elbow crease, so comfort for when they have, because again, it's a stronger material on the arm, so a little bit stiffer, and patients have a lot of sensitivities in the crease of the arm. So it comes in one option for a silicone top band and a porous row. You'll notice with the Mondy Esprit, it's soft, yet has a firm nature to it. So it's got a little bit, when we start talking about flat knit for the lower extremity, we've got other materials that might be feel a little bit coarser. So this has a little bit more elasticity to it and more nylon wrapped around the stitches. You'll notice that the weave, you can see through it when you pull apart. That's aiding again in moisture wicking and breathability of the garment. When a proper fit of a garment for a flat knit, many times a flat knit may feel cooler than a circle knit because it's got a wider knit to it and it's giving more support to the arm. Depending on, so this is going to be your stage 1, stage 2 lymphedema. They've got some hard tissue in the arm. They've had some skin issues. Containment, they fluctuate a little bit more. The containment of the Mondy Esprit is a good option for that. It also comes in a glove, in a ready-to-wear. So you've got a flat knit glove and a flat knit arm sleeve that are available and ready for it. These come in only 5 different sizes for the Medivin ready-to-wear. This is the same material as our custom Mondy Esprit. We call it Mondy Esprit for the upper extremity because they wanted to differentiate between the lower extremity. We have a Mondy lower extremity flat knit and a Mondy Esprit. There's no difference in the materials beside the Esprit to make it a little more different, I guess. Strong material for all-day support, soft finish yet micro-massaging, customizable for shapes and sizes, so it's available in custom options. Our Climate Comfort releases moisture for temperature control. So our Climate Comfort is in all of our products, that moisture wicking, pulling moisture and heat away from the arm. Ideal for skin issues such as infections and soft sensitive skin. So soft sensitive skin or breakdown or any patches on the arm, it's really good. And again, with lymphedema, they oftentimes have different skin issues. So a greater containment can help with that. Combination of both elastic and inelastic properties so that to provide that strong compression to the arm for serious edema containment, and a low elasticity for dynamic compression. So one thing that separates our flat knit, We have less of a vertical stretch in our garment because we want to be able to contain. When we take custom measurements, you're taking it along the contour, and we'll review that. But we have a greater circumferential stretch, but a low vertical stretch. And that's important because we want it to get a good fit and contain appropriately, not necessarily something that's just going to get on. And that's where it's important to, if a person or a customer needs a custom option, that we strongly encourage that because it's going to be a better fit for them and to better treat their condition.
With that,
Yeah.
Yeah.
Mhm.
Yeah,
Yep.
you can feel the difference in the material, just what you were just saying. I was sitting here.
Yeah.
start doing that.
Good.
And I'm like, oh, yeah, okay.
That's providing that strong containment because there's fluctuations. How much do we have time right now?
We open at 10.
Okay, so I got half an hour. So in the back of our book, and please, any questions on the Mondi? I will talk briefly now about custom Mondi. So on page 15, we'll talk about the custom 550 and Mondi Esprit upper extremity. There are two options for custom upper extremity. The one that I passed around is the ready to wear. This is an example of the custom option. This is just highlighting. You'll notice it's the same material, same porous row, but this is highlighting a few different options. You'll notice that the knitting mark is wider, so that's showing just another option for greater flex and degree of flexion in the arm. And if we pull it inside out, this is highlighting silk that can be added, as well as a top band that could go 3/4 round and a gradual lateral rise in the garment. This is available in both the 550 and the Mondi. I'll pass around this swatch of the 550 arm so you can feel the difference in material. Our 550 material is our workhorse. It is the most robust material that we have to offer. High containment. It's ideal for fibrotic tissue to really help break that up. The majority, I recommend for the majority of the patients that you need custom that are coming through the door, because you've got a lot of options and we probably want to try to narrow it down, your Mondi is going to cover 95% of those needs. So you're good with sticking with Mondi for the majority of the patients that are getting referred from the therapists that I work with here. Because of the sensitivity of the arm, getting it on, the flexibility, people doing and working hard or needing greater flexibility in the arm, Mondi works great. Now, let's say you've got you've got an active duty serviceman who's really getting after it, really hard on their garments. Maybe they got a lot of fluctuation in their swelling of their arm or their hand. 550 might be a good option for somebody like that because they're really aggressive and beating up on their garments. But you'll notice on my Mondi, I've had that sample for 5 years. I've taken it in and out of my bag. You'll probably notice there's a few nicks in there, but a 5-year-old sample of being put on and off just shows the detailing and the seam finishes and the durability of the material. You're going to get some nicks, and that's not worn every day like a patient's going to wear every day, but it holds up very well. What was
the purpose of, I know this was, what was the purpose of this soft area?
The silk lining is a purpose to help because they have some sensitivities in the crease. Maybe the skin breaks down because they need a higher compression. And when the material is directly against the skin, and that friction can break the skin for just sensitive. So the silk lining just helps smooth out that area so it doesn't crease the skin and break it. Even though this material is very soft compared to the 550, they can have some breakdown. If we go to on the back of your swatch sample for your flat knit, we'll talk about all the colors and the patterns that are available for the for both the 550 and the Mondi. The Mondi we've got the Timeless, Live, Laugh, Love, and our Sportive. So we've got some nice patterns and then different colors. Your most common are going to be your caramel and your sand. The compression classes available in custom are 1, 2, and 3. Now let's go to the back. You can either go to the back of the book or to the custom upper extremity form that you have. Everybody has the upper extremity form, so we can go to that. It is the one with the 3 ladies taking a selfie. The form here that's different from the book. This is great to keep because this is going to give some troubleshooting, how to measure for the hand and how to measure for the fingers and the arm. It talks about the shoulder caps, the lower arm, where to take your landmarks for taking length, and where to take your circumference landmarks. When you go to the back, when you start, both pages need to be filled out. When you're filling out your form, on your upper extremity, you need the customer name is your name. Then it's important to have the patient's name and then whatever PO, if you need a specific PO. Both need to be filled out on both sections. The top part is going to talk about the material. So you've got 2 options, the 550 or the Mondi. The style and quantity. You have an option for an arm sleeve, and it says CG, so that's saying to G, to the axilla only. You've got a long hand section, so we can do an option for a glove that extends longer. You've got an option for one hand and arm combo. So we can do one arm sleeve that has a glove and arm sleeve all in one piece. And you can do 2 pieces. The most common are going to be a hand and a glove, 2 pieces. Porous row for half compression. That's indicating that we're going to automatically build in the porous row for both the custom arm sleeve and the custom glove because they're going to be worn together. When looking at page 15, it's highlighting all the options that are available in the 550 and the Medi or the Mondi Esprit Custom upper extremity. So you can do a gauntlet, glove, arm piece. What this does not show is that there are, for the arm piece, it's only available for the 550, not the Mondi. Arm sleeve is both. And your gauntlet with arm piece combination and gauntlet one sleeve. So if there's a star, it's indicated that it's 550 only. And I think they made that little mistake there for the hand piece. The reason is because certain ones aren't available for both, because the 550 is very stout and firm and stiff on the arm. So you can do almost anything with it. Due to the elastic nature of the Mondi, it's not good. You can't do as many customized options with it because it may slide or might not stay in place like the more stout material. Does that make sense? It more comes into play when we're doing some leg pieces and stuff for the lower extremity because of the stout nature of it, of the material. So your style and quantity, your hand piece, gauntlet, glove, you can choose between open fingers and closed fingers. And then your compression. There's different compression levels for compression for the hand and the arm sleeve. We don't encourage for you to have, they strongly encourage having the same compression for the hand as you do the arm sleeve, or 30 to 40, like if you did a 3 in the hand, you could do a 2 in the arm sleeve. You don't want to go opposite. But that would be indicated based on the therapist giving that prescription. But your hand piece can be compression class 1, 2, or 3. When we're talking about custom garments, all of the manufacturers use the same verbiage, compression class, 1, 2, or 3. You'll notice that it's different than ready-to-wear compression. So compression class 1 is 15 to 21, compression class 2 is 23 to 32, and compression class 3 is 34 to 46. That is a industry-wide difference and that's more how Europe and Germany, who specializes and developed compression for all of the manufacturers, and how they manufacture with the flat net have to differentiate. But you're very similar in compression classes on that. So it is slightly different than saying 20 to 30 or 30 to 40, but you're still within that same range. So 20 to 30 is relatively similar to compression class 2. Then your support options. These are important to indicate because you've got your top band options. You can say none, or you need to mark whether you have a beaded or silicone. There are different level or different types. In your swatch sample, you will have the top band options to choose from. Here, there's also a card which indicates on both sizes. This is a great card to reference and talk about the different grips and why each grip is important, whether the small bead or whether the profile bead. Definitely use this as a resource for your custom options for both the upper extremity and lower extremity, because different silicone top bands can provide a different level of support to stay up on the arm. And it's important to know the difference if you're doing a 5 centimeter versus a 2 centimeter, because you want to know, where am I stopping the compression at? So 5 centimeters is going to take 5 centimeters away of compression. So if they've got swelling and edema up the arm, it's important to take that into consideration. You're probably not going to do many shoulder attachments. I don't really encourage them. They're difficult. You're clipping onto the bra. You're wearing it across. They've got a lot going on. Patients who've gone through radiation. Less is more. But you do sometimes have to do it. Having a shoulder attachment and a cap does not mean higher compression on the arm. It's just more material up here. So when I'm training therapists, I'm letting them know that, yes, if you add more material here, it's not necessarily compressing that area and containing it. It's just applying more material. But various reasons would indicate why they might need that shoulder attachment or something. So it is an option to know about and talk with your patients on. Then your oblique endings are very important. The oblique ending is providing a lateral rise. So when you've got somebody who's got a fuller arm, it's important to have that oblique ending because it's going to go out a little bit further to help a better fit. So it's not just stopping at a straight line. You can do a straight line ending. You have a standard oblique or a steep oblique. That's either a 10%, 5% or a 10% increase in material. That 5% or 10% is a percentage of the circumference at that G measurement. So percentage of it's going to raise and make that rise. So the sleeve, the custom sleeve I just passed around,
So it's going to be
angular, lateral outside rise. So it's important to know that. And most of the time you're going to do a standard oblique, especially if they get a little further. Takes away a little compression. So sometimes you don't want to do steep because then it might just be too loose if they don't have. For myself, I might do a straight ending. I don't necessarily need a lot. A fuller upper arm might need just a little bit of rise for a better fit. We want to get it high in the axilla and good containment. So important to note about that. And your knitting marks. Your knitting marks are important because that's providing greater flexion. I believe in less is more, but if somebody is sitting in a chair or somebody who's in a wheelchair bound or they're sitting at a desk for long periods of time, you want to add greater flexion because their arm is bent in that tourniquet most of the day. But somebody who's walking, doing up and they've got, they're not having their arms bent the majority of the day, they might not need one at all, or you would do standard. So that's that differentiate. You're asking those questions. Are you sitting all day? Are they not moving? Are they in their recliner all day? That's what that knitting mark is going to help create that break in compression. Your silk lining, we can do a lot with our silk lining. You can silk line the seams. Many patients have sensitivities to the seams, and the therapists don't like the indentation that it can provide. You can do a silk lining of the seam. You can add lymph pads to sections of the garments. On this page that I handed out, Medivin flat knit custom options. This is highlighting a few upper extremity. We'll go over this for lower, but it's highlighting silicone dotting that can be added on the outside of the gloves for grip for people who do a lot of driving. So the driving or silicone dots on the outside of on the inside of the sleeve for better fit and grip on the arm. So these are important to know the options that are available to make it and differentiate us from the others on the custom options that can be done. That you would highlight on your silk lining or your lymph pads or your dottings. The additional note section is very small. Don't worry about that. If you need to write anything else, you're going to either add a separate page saying C notes or write on the side of the form. Your colors and your options. And then you're filling out the custom size options. I think because I've talked a little too much, we won't be able to practice today, but on the next video, we'll do hands-on custom. And that'll probably be good. Maybe we'll just do the individual and we can do that slowly, and I can do that on that. Thank you for your time. I really appreciate it. So today, ready to wear upper extremity and custom for circle knit and flat knit. You've got your literature pieces, and please don't just wait. You know, you can go over anything ahead of time. Next time we'll go over inelastic and our circate upper extremity custom, and then we'll make our way through lower extremity. Thank you.